My name is Stacey Hurd, and this is Assignment 3 for Advanced Clinical Exercise Science. Part of the course was to undergo 40 hours work placement within a clinical setting where exercise is used to develop health benefits for a population with clinical conditions. A logbook of hours was completed describing session type, patient details, objectives, and description of observations and activities. I conducted my work placement at Redlands Exercise Physiology, situated within Victoria Point's Health Work Centre. I was supervised by owner Matthew Parrish, who became accredited in 2012 from Southern Cross University and opened his own business shortly afterwards. Matthew works with one other exercise physiologist, Sally Dersra. Redlands Exercise Physiology provides individual and group exercise treatments and rehabilitation of people at risk of chronic diseases, neurological and musculoskeletal conditions. Clients can undergo a variety of home or gym-based programs, hydrotherapy, group sessions, online training and podcasts. Retirement home group sessions and Defence Veterans Australia clients are also worked with. The majority of clients who go through Redlands Exercise Physiology are older adults, DVA clients, and work cover rehabilitation clients. While I was undergoing my work placement, I observed a variety of clinical conditions that were being treated with exercise. Diabetes, hypertension, post-traumatic stress disorder, lower back pain, stroke, asthma, and rheumatoid arthritis were just a few of the conditions that I came across. Initial consultations, pre-exercise screening, hydrotherapy sessions, and work cover consultations were all observed throughout my work placement. During these sessions, I observed the design and implementation of exercise programs and how to modify these programs within sessions, depending on client feedback or observation of the difficulty or ease of the work. Maintaining conversation with clients was found to be important for client motivation. While I was there, I was tasked with helping and organising hydrotherapy and retirement home sessions, helping clients with stretches, or rather making sure they do them, instructing clients on circuit training, as in which exercise to switch to, how many reps that they've been doing, keeping clients talking to not only maintain motivation, but also to easily monitor their RPE level. I learnt many new things during my 40 hours work placement. Correct procedure and techniques for different exercises, how to modify these exercises, making up new ones to incorporate the same skills at an easier level for those with less functional capacity, and how to write SOAP notes. I learnt new skills as well, such as how to use TRX, resistance bands, medicine balls, and kettlebells, which I have had very little prior knowledge of, and how to construct a range of exercises using this equipment. This was the best work placement I have so far completed, to the point that I have changed my mind about what I wish to specialise in when I graduate. I love working with people who can help live a happier and healthier life. For the written report segment of the assignment, I have chosen the topic of exercise programming for older adults with cardiovascular disease and motivational methods to maintain programs. There will be a substantial increase in the number of elderly people in the next 15 years or so, due to the baby boom generation all reaching older adult status of over the age of 65. This group is known to have the highest rates of chronic illnesses, as well as the lowest rates of physical activity. Many factors are associated with aging that decrease a person's functional capacity and thus their independence. Cardiovascular disease is largely associated with this group. There is, however, lots of evidence that shows that physical activity is both a primary and secondary preventional method for CVD. The recommended level of exercise to maintain a healthy lifestyle is 150 minutes per week at a moderate intensity. Older adults might find this hard to complete due to loss of capacity, depression, monetary costs, feeling unsafe, and among other reasons. Leisure time physical activities, such as gardening, household chores, or walking the dog, have been found to be of great benefit, especially to the health of those who, through aging or disability, may not be able to commit to the normal amount of physical activity required. Exercise programs need to be tailored around specific illnesses and individual functional capacity. This report examines effective exercise programs for older adults with CVD and methods to keep them motivated. Data was collected from previously conducted surveys on exercise programs in prior research paper. This data was collected on 3 topics: the benefit of leisure time physical activities, motivations for exercising of older adults, and effective exercise programs for the elderly. It was found that even a small number of leisure time physical activities show a significant health benefit when compared to those with a sedentary lifestyle. A dose-response relationship was expressed, stating that the more exercise or leisure time physical activity a person does, the greater their health benefits. A mixed exercise program was found to have the best overall health benefits, especially on the reduction of percentage body fat, which is a main contributing factor to CVD. Many pros and cons were found for exercising by the elderly. Lack of facilities, disability, and low awareness of exercise were the most commonly noted negatives towards exercise. The positives, however, were interesting, as the majority of people stated to exercise not only for improvements to health and confidence, but to pass the time with others. Financing of exercise was also a very large motivational factor. The gym environment can be scary for those who have not experienced such an environment before. Not only this, but gyms can be expensive for pensioners who may not have the funds to gain or maintain membership. Exercise physiologists that work out of a gym can get people to overcome their negative thoughts of the gym environment, but with discounts for sessions that are non-referrals could be the factor that convinces older adults to commit to exercise. Gym-based exercise programs that incorporate aerobic and strength resistance training are the most beneficial programs for older adults due to the variety of health problems they may have. Physical activity has a dose-response relationship, so the higher the level of exercise, the faster and more efficiently the health issues can be rectified. Group training sessions are also another benefit for those clients who need to get away from the stress of life and just relax with others while exercising. Leisure time physical activities were found to be great for staying active at home. However, a higher form of exercise may be required for those with more detrimental health issues. Older adults are more likely to commit to exercise if it can be done in a safe environment with options for more socialization. Financial aid for exercise sessions would dramatically increase the numbers of older adults in gyms. For those who are unable to exercise at the recommended daily level due to disability, leisure time physical activities still show a benefit to decrease risk factors for CVD. Practical implications for this review are to help professionals learn motivational techniques and a range of techniques for CVD exercise programming. Listed below are references associated to the data explained throughout this review for additional reading should you have any additional questions.